Bon après-midi tout le monde et bienvenue.
Good afternoon and welcome to today's update on COVID-19 in New Brunswick.
And thank you for joining us this afternoon for today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and the Honorable Dominic Carty, Minister of Education and Early Childhood Development. Les porte-parole.
The spokespeople today are Chief Medical Officer Dr. Jennifer Russell and Education Minister and for Early Childhood Development, the Honorable Dominic Carty.
Thank you, Bruce. See, Bruce.
Thank you, Bruce.
Bonjour, everyone. Good afternoon. On est ici.
We're
Le long weekend
We are here on a Saturday during a long weekend.
that any of us were hoping for. Ce n'est pas vraiment le début de le long.
It's not the kind of a long start to the long weekend that we were hoping for. Today, I announced that there are 20 new cases of COVID-19 in the province. 12 of these are in Zone 1, the Moncton region, 7 in Zone 5, the Campbellton region, and 1 in Zone 3, the Fredericton region. The new case in Zone 3 is an individual between 50 and 59 years of age and is related to travel outside the Atlantic bubble. The new cases in Zone 1 include an individual between 20 and 29, 2 people between 60 and 90, 2 people between 70 and 79, 4 people between 80 and 89, and 3 people over 90. 9 of these cases are related to an outbreak at the Manoir Notre-Dame Manor, and 3 are under investigation. All of them are isolating.
Okay.
So the new cases in Zone 5 include an individual under 19 years of age, an individual between 20 and 29, an individual between 30 and 39, an individual between 50 and 59, 2 people between 60 and 69, and an individual between 70 and 79. All these cases are related to a regional outbreak, and these individuals are self-isolating. At this time, both the Campbellton and Moncton regions remain in the orange level under the province's COVID-19 recovery plan. And when I say Campbellton, I mean Zone 5 of Campbellton, Restigouche, and Dalhousie.
COVID-19 to announce. 12 of the cases are in Zone 1, the Moncton region, 7 are in Zone 5, the Campbellton region, and 1 is in Zone 3, the Fredericton region. The new case in Zone 3 is an individual between 50 and 59 years of age and is related to travel outside the Atlantic bubble. There's a new cases in Zone 1, and they include an individual between 20 and 29, 2 people between 60 and 69, 2 people between 70 and 79, and 4 people between 80 and 89, and 3 people over 90. 9 of these cases are related to an outbreak at the Manoir Notre-Dame, and 3 are under investigation. All of them are self-isolating. The new cases in Zone 5 include an individual under 19 years of age, an individual between 20 and 29, an individual between 30 and 39, an individual between 50 and 59, and 2 people between 60 and 69, and an individual between 70 and 79, and these are related to a regional outbreak and they are self-isolating. At this time, both the Campbellton and Moncton regions remain in the orange level under the province's COVID-19 recovery plan. We ask that you do not travel into and out of these zones at this time unless for essential services, as we do need to do everything we can to stop the spread of this virus, and travel to get your hair done does not constitute essential service. So we know there are students at post-secondary institutions in those zones who want to go home for Thanksgiving dinner. If you haven't already left, we're really asking you not to travel to those zones at this time, as we really, really need to slow the spread. And all the other zones in New Brunswick remain at the yellow level. No matter what zone of the province you are in, you must follow public health measures and guidelines. All New Brunswickers must work together to keep our numbers low, and masks are especially important. All New Brunswickers must wear masks indoors when in public spaces, and residents in Zone 1 and 5 must wear masks both indoors and outdoors. Le port du masque est très important. Toutes les personnes du Nouveau-Brunswick.
Masks are especially important. All New Brunswickers must wear masks indoors when in public places, and residents in Zone 1 and 5 must wear masks both indoors and outdoors.
Of the vulnerable members in your family, especially this holiday weekend when there will be increased interaction. This is not a time to stigmatize our fellow New Brunswickers or get complacent because your zone is currently in the yellow level. It's also not a time to point fingers. It's not a time to put out misinformation on social media. The best place to get your information is the GNB website. This is a time to remember that we are truly in this together. Puis je voulais raconter une histoire aujourd'hui. Mon père.
Many people, well, my father had a great boat when he was young, but every year he had to make repairs to make sure that there was no hole in the boat. Otherwise, it would take water. Now we have holes in our ship, and we need the help of all to repair those holes. So masks, not traveling unless it's needed, staying home if you have symptoms, and have yourself tested. It's very important that we all work together to make sure that our boat does not take water. We want to continue to have great trips and great future get-togethers. Many people in all parts of the province are working hard to follow the proper measures and limit the spread of the virus. I am encouraging all of you to be one of these people and to follow the necessary measures to protect you and your family as well as your community.
2 meters of physical distance between yourself and others whenever you can. In public spaces, wear a mask or face covering. Always keep a couple of masks with you when you are out and make sure to wash them regularly. Wash your hands regularly and thoroughly. Cough and sneeze into your sleeve. Regularly clean high contact surfaces like kitchen countertops and door handles. La prise de chacune de ces mesures nous aidera à limiter la propagation de la COVID-19.
Each of these measures will help limit the spread of COVID-19. Each of you can change things.
We are seeing that the close contacts are people who have been with other people for 15 minutes or longer within 6 feet, not wearing a mask. So again, when you calculate how many people exist in your life who you are having these kinds of interactions in, that is how many people we have to contact trace. And if we're up to, 57 active cases who all have 6 to 10 contacts to trace, that is a very large number of people, and that is very, very hard to stay ahead of. So we really need your help to keep that number low. Toutes les personnes de la province doivent être.
All people in the province should be aware and watch for COVID-19 symptoms. If you feel bad or have symptoms, isolate yourself and follow the measures necessary to follow a test.
Online form available at the coronavirus webpage at gnb.ca. The online form is quick and easy to fill out, and I encourage anyone who can use this option to do so. And I want to take a moment about testing and self-isolation, as I know there are people who are confused about this and when you should do either. So both are key to containing the virus spread. What's most important is that we test the right people, which today means those people who have symptoms who have recently returned from traveling outside the province, and people who have been notified that they have come into close contact with known cases. And I do know that people get confused about exposure and who's at risk. If you have been notified by public health that you are a close contact, you are at risk of developing COVID-19, and therefore you should self-isolate, and if you have symptoms, get tested right away. In addition, we are also making available at this time the option for individuals who travel across the Quebec border daily for work to be voluntarily tested, even if you do not have symptoms, and you can arrange for your test through the online form. And again, as we've seen the numbers increase outside of our border with Quebec, we know that it's critical for people to take as much care and caution as possible. I would like to take this opportunity to share a bit more information about testing, why we test and who we test and when we test. It's important for New Brunswickers to understand the amount of testing we conduct has no impact on flattening the curve or slowing down the spread of the virus. We need people, again, to follow the public health directions at all times. That's what keeps the numbers low. That's what keeps the virus from spreading. But if you do have symptoms, it's important for you to get tested so that we can isolate you immediately and we can isolate your close contacts immediately. That is what slows the spread of this virus. As a result, you will be contacted, if you are positive, you'll be contacted by public health and told to self-isolate for 14 days. And we want these measures in place to protect you and your family and friends from further spread. So the general rules of self-isolation are to stay home, monitor yourself for symptoms such as fever, cough, difficulty breathing, avoid contact with others. And if there are people living in your home, you should really stay in a separate room, use separate bathrooms if possible, and maintain a distance of at least 2 meters or 6 feet apart from others, and keep your interactions brief. Avoid sharing personal items. Nous avons tous la capacité et la responsabilité de nous protéger les uns les autres.
We can all protect ourselves, each of ourselves. It's by supporting each other that we will be able to go through this test that is testing us not only physically but emotionally.
With the Chief Medical Officers of Health from Nova Scotia, Newfoundland, and PEI this morning, and they are all concerned about what's happening here in New Brunswick, and they offer their support. And I did agree to make sure that they were kept in touch with us with respect to how things are progressing. And they are aware that there are probably many people from their provinces who have come here for Thanksgiving. And I assured them that I would let them know that I would be letting people know that if they've come to Zone 5 or Zone 1 for Thanksgiving, that when they return to their home provinces or anywhere else in New Brunswick that they're going back to, they really have to be diligent about wearing your masks, hand washing, social distancing, physical distancing, and really avoid vulnerable populations in congregate settings. And if you have symptoms, please get tested. So we really weren't wanting people to go to Zone 1 and 5 this weekend, but if you have already gone to that area, again, when you go back to your respective areas, please be very, very vigilant. But if you've already gone to Zone 1 and Zone 5, again, you really want to make sure that everybody you were traveling with is doing as much as they can in the next 14 days to watch for symptoms. We want people in the orange phase in Zone 1 and Zone 2 to limit their contacts to just 2 household bubbles and continue to follow physical distancing measures, wash your hands, etc. So even during these challenging times, like we are facing right now, there is much to be grateful for. I am grateful for all of the staff who are working this weekend. I know some of them sounded quite concerned and very anxious for the well-being of all New Brunswickers right now, because we have 2 zones that are affected right now, but we don't want that to increase to any more zones at this time. So we need to help them do their work by doing our work as citizens. This long weekend might not be what we planned, but I encourage you to take a moment and be thankful for all that we have. And if you know people who are working in essential services or healthcare settings or public health or any of the areas that are dealing with outbreaks, please offer them your support. We live in a beautiful province where people look after one another and where we can truly keep one another healthy and safe. Ici, vous avez des membres de la famille ou des...
And if you have members of the family in Moncton or Campbellton, contact them and let them know you're thinking about them. They need your support right now. And be honest, we all need your support at this time. And especially, be caring and support each other.
In a difficult situation. Thank you.
Good afternoon. Après-midi. Bienvenue. Merci, Dr. Russell.
Okay. Miss.
This is a time which I think we all hope would not reach us here in New Brunswick after a long summer where we had a respite from a disease that's ravaging the world. And we're able to look on from the security of our privileged corner of Canada. Now COVID-19 is back within our borders, and we need to show the same resilience, the same strength that we have in recent months that led us to that privileged place as we try and push back against this disease. Because, as Dr. Russell said, our boat is taking on water, and it's up to all of us now to figure out the ways that we can plug those holes.
We need a collective approach. To push the virus outside of our area again. We were very lucky to live in New Brunswick and Atlantic Canada. We were able to protect ourselves through our own acts against COVID-19, but now the virus is back, and we have to act the same way we acted in March, April, and May, the way that the people in Campbellton already acted. They've done it once, they can do it again.
As Education Minister, only imagine the stress that parents and families and teachers are feeling across the province right now. And this is a day I hoped I would not come, that I would have to stand and announce a first case linked to a public school in New Brunswick. So on Thursday, letters were sent out to families and the school community to inform them of a positive case of COVID-19 that had been confirmed at Sugarloaf Senior High School. So students at the school will be engaged on online learning, fully online learning, on Tuesday, October 13th and Wednesday, October 14th. So this decision was made earlier last week to help students from Pointe-à-la-Croix and Listegouche communities who attend the high school to transition to full-time online learning. And that was necessitated by the actions of the government of Quebec. And we're doing our very best to accommodate the small number of students who attend school in New Brunswick. But today we have a second case in a school. The case has been confirmed at the Académie Notre-Dame in Dalhousie.
So, in addition to the Sugarloaf case, we now have a case at the Académie Notre-Dame in Dalhousie. And know that all the professionals and parents and students have a very understandable level of stress. And we also have all sorts of questions for public health and for others and what this means for their education.
Everyone involved in the school communities are waiting anxiously to hear directives from public health around how this is going to impact their child's education and, of course, the health and safety of their children. And at the Department of Education and Early Childhood Development, we've been working closely with Dr. Russell and her team over the last months on a day-to-day basis to make sure that we can have a school system that is as safe and protected as possible for the students and for the adults. Of course, in the last few days, that work together has only increased. But when it comes to you as parents watching today, no news is good news when it comes to hearing from public health. You will hear if you need to hear, but otherwise, please do, as the doctor said, refer to the GMB website and to formal news channels when it comes to finding out information about the safety and security of the school system, of the school that your child or children may attend, and about the health and safety of your particular children. We need your help. We need your help to make sure that contact tracing can be done quickly and effectively. The contact tracing process will determine the security measures, the safety measures that are put in place for each school. Alors, on demande aux familles liées à Académie.
We are asking the people connected to Académie Notre-Dame to be patient, to wait for communications from the school, and we promise that we'll continue to work during this long weekend to make sure all families that need to be contacted will be.
From public health, if there's any risk of a case or a contact, you will hear from public health. And I'll take this moment to remind people, please download the Government of Canada app. Put it on any cell phone in your household. If If your children have cell phones, here's a good use for them. Make sure that we get this app out there and shared as broadly as possible. S'il vous plaît, une mesure qu'on peut tout prendre.
This is a measure that we can all do to use the Government of Canada app. It can easily be installed on all cell phones, and we know that most young people have a cell phone. So please download the app from the Government of Canada.
We now have 2 zones that are in orange, and we now have lots of parents have questions on what that's going to mean for their schools, as well as parents across the province who have concerns about what this means for them. On sait que maintenant, avec 2 zones qui sont dans l'orange,
with 2 orange zones, many parents have questions. And we know that masks are an effective and safe and simple way to fight the coronavirus. And that's why we are going to change the protocol for mask use in public schools in the zones that are now orange. These measures will apply to all students as well as adults, with the exception of those who have medical excuses for not wearing masks, and there aren't very many of those. And this will be in effect as long as those zones are orange.
I know that parents are going to have lots of questions about what that means. In concrete terms, the main change for schools is that mask use policy will change, because we know that masks are an effective and simple way of preventing the spread of COVID-19. So throughout the orange phase, so from now through till the time when those zones leave the orange phase, there's going to be a change in mask policy for everyone in the public school system. They're going to be required to wear masks whenever possible unless they have medical exemptions for doing so. And the reasons for getting a medical exemption from mask use are very hard to find. There's no reason for most people, under all circumstances, not to be able to wear a mask. All students in grades K to 12 are required to wear a mask whenever they're on a school bus, even when they're sitting with a sibling or alone. For students and staff in grade 9 to 12 schools, masks are required at all times when in school. And the only exceptions will be when they're eating or engaged in physical activities such as gym class. And this includes when the students are outside for learning or during breaks. So
for all students from K to 12, they must wear a mask, even if you're sitting alone on the bus or with a sibling. For those between grades 9 and 12 in high school, you must wear masks at all times. The only exceptions is if you are eating or if you're doing physical activity in the gym. Outside, during breaks, the mask must be worn. For those from K to 8, you must also wear masks whenever you're in the school. The exceptions is when they may be eating or when they are working alone and quietly, or during phys ed classes.
In grades 8 down to kindergarten, masks are going to be required at all times when the students are in school, except when the kids are working by themselves and quietly, emphasis on quietly, when they're eating, or again, engaged in gym class. For grade 9 to 12, the only exemptions, again, are gym class and eating. Every kid on a school bus has to sit with a mask, whether they're sitting alone, with a sibling, it doesn't matter, masks are required at all times. While a region is in the orange phase, all intramural sports, interscholastic, and extracurricular activities are suspended. This includes Systema. It includes school sports, drama, music, and any other after-school activities. Students who are immunocompromised, school personnel who are immunocompromised should contact their healthcare provider for direction. Distance learning plans will be put in place until they are able to safely return to school. While we're in the orange zone, all extramural sports
interscholastic sports, and extracurricular activities like drama, dance, and all that are suspended for. And the members of the school team that have immunocompromised can contact their doctor to follow their directions. We will put the distance working and distance studying in place until they can return to school safely. And for more information, please consult the Education Department website.
Any questions about the return to school plans can consult the government's website at the EECD page, Early Education and Early Childhood Development. For early learning and childcare facilities, children are going to be actively screened before entering the centre or home, and children will not be able to change groupings throughout the orange phase, and all field trips will be cancelled or postponed. For children aged 2 and up, masks are required when they're in common areas. And for after-school programming, masks are required at all times, including within the classroom, in common spaces, and outdoors. Exemptions will be when they are sitting at a desk working silently, or eating, or in play during sports activities. Children being provided transportation through their early learning and childcare facility are required to wear a mask at all times while in the vehicle. And more information on those guidelines for early learning and childcare facilities are available on the parent portal, again on the EECD website. Pour les centres d'éducation de la petite enfance, encore les changements que tu peux voir sur le portal, sur le site web du ministère.
And you can get more information on the department website. And these measures are only there while these zones are at the orange phase. And these are necessary measures. We're doing everything we can to fight the pandemic. And once we get back to the yellow zone, all schools will be able to come back to the way things were before.
While zones 1 and 5 are in the orange zone. When we return back to yellow zone, and hopefully that'll be yellow phase hopefully that'll be as quickly as possible, schools can go back to their previous operational plans. And it's an important point to emphasize that a lot of the concerns that we hear about use of masks and these protocols, people get scared, they get spooked, and they ask, is this going to last forever? Is the world ever going to go back to normal? And it is. And it's going to go back to normal because we as people in this province decide that we're going to take the necessary public health measures to stamp out COVID-19. And we're doing this so that we can return to normal as quickly as possible. We're doing this so that we can hug people again. We're doing this so that we can see people smile without a mask in the way. But the only way we can get there is if we act decisively and with confidence in following the measures that Dr. Russell and her team are encouraging us all to use. This is our choice, and we all have a role to play. I know that you're going to have many more questions and certainly have more questions in the months and weeks to come. I'm committed to keeping you as informed as possible as we go through this school year. I do also have to emphasize that we will be doing everything we can to protect the privacy of everyone involved in the school system.
Despite the fact that we are going to communicate everything we can with all the details we can on these outbreaks, we also have to protect people's privacy of the pupils and the school teams. So we will share all the information we can, but no personal data for each case. That is, we don't want to create an atmosphere of suspicion. That helps nobody. We have to. We need to get together to work in solidarity. I mean, we can't say that this person did something or that person did something. We have to follow public health guidelines, and we will share all the information we can. And I give you my word that we will do that in every legal way we can.
Families and school staff are going to be communicated through the schools and the districts, and we'll continue to provide all the information we can while, again, protecting the privacy of students and staff. So please be kind and be patient. Encourage your children to be kind and patient in person and on social media. And the same goes to adults. So this week, Premier Higgs announced a mandatory mask policy. And I reiterate again how for all of us across the province, those outside of zones 1 and 5, the way we can help the people in Moncton and the Campbellton regions get back to a normal life or as close to it in the context of this pandemic, the way we can help them is by all of us wearing a mask. All of us following the advice of Dr. Russell to avoid non-essential travel from this moment onwards. Yes, it's inconvenient. Yes, it's annoying. But do not contribute to the spread of this disease. The sacrifices we're being made to ask in terms of irritations, interruptions to our daily routine are nothing compared to the stories that all of us see in our TVs and computers as we look from around the world and see the evidence of what happens in places who do not take this disease seriously. We've led the world to now in our fight against COVID-19. Let's not lose that position. Let's continue to act together. And on this Thanksgiving, be thankful, as the doctor said, for all that we have, but use that as well as a reminder for all that we could lose if we do not act together at this difficult time. If we head into Thanksgiving, I know I've canceled my trips. Say to my mom and dad right now, I'm sorry I won't see you this weekend. They live in St. Andrews, outside of any infection zone. But there's no reason for me to travel right now that would risk endangering their health or the health of the other people I might come across. Alors, quand on prépare pour l'Action de grâce, on a encore...
So as Thanksgiving comes up, we still have many reasons to be happy here in New Brunswick. The actions we take today and next week will decide where our province will be heading for the rest of 2020 and hopefully 2021. So follow the guidelines from public health and follow the recommendations from Dr. Russell and her team. We still have many reasons to feel lucky to be here, but we could lose all that if we let ourselves go in the weeks that come. Once again, thank you. I'm ready to take questions, and let's continue. Thank you.
Merci, Monsieur le Ministre Cartier, Dr. Russell, Ministre Cartier. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Chaque journaliste aura une question et un suivi. We will now proceed with questions from the members of the media. You have the right to pose your question in the language of your choice. Each reporter will have one question and one quick follow-up. Alexander,
a question for Minister Carty. How many students at each school have been asked to stay home and isolate?
Hey, thanks for the question. Again, I can't give information around individual numbers like that. We will be providing, under direction from Public Health, confirmed cases as those are identified. And the best way to make sure that we get those cases confirmed whenever they are is to engage in the contact tracing system as quickly as possible. And so that's what's going on now. Alors, dans ce cas, c'est impossible.
In this case, we cannot give all the personal information on all these people. We'll only talk about the confirmed cases in order to protect the privacy of the people, but also because we don't want to add to the work that Dr. Russell and her team have to do.
Follow-up for Dr. Russell. Do we know anything more about the source of the Campbellton outbreak?
At this time, the contact tracing is still ongoing. It can take several days for that kind of information to surface, so we're still actively investigating any and all cases at this time, and we will continue to investigate any new cases as a result of the close contacts that may become symptomatic that will then be tested as well.
Thank you, Alexander. Travis Fortnum, Global TV.
Hi there. My question is for Dr. Russell as well. Pretty similar to that. I understand that this contact tracing is still ongoing. I'm just wondering if it's at all likely that any of these cases are the result of community transmission.
It can be likely, actually, until we actually find the source of an outbreak. We have to be prepared for that outcome. So again, we're working diligently, and the best way for us to do that work is for everybody in the public to help us by answering your phone when public health calls you and providing as much information as you can. Sometimes it takes a few discussions and a few conversations. Download that app. We really, again, we need to throw everything in the kitchen sink at this, and that's what we did the last time when Zone 5 was in an outbreak situation. And at that time, we didn't have a concurrent outbreak in the Moncton area, so we have 2 outbreaks ongoing concurrently, so the more help we can get, the better. And the fewer contacts people have, the easier it is for us to do that contact tracing. So again, to echo what Minister Carty said about staying put this weekend, the fewer people moving around and the fewer people accumulating more close contacts, the better. That is how we are going to get through this.
Thank you, Dr. Travis. Do you have a quick follow-up?
I do, and it's for Dr. Russell as well. And on that note of the application use, I'm just wondering if you have any information on how many cases confirmed positives have been because someone got a notification on that app, potential exposure.
I haven't received any information on that. If I do, I can pass that along to you.
Thank you, Mr. Fortman. Thank you, Dr. Vicky Hogarth, CHCO TV.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, just for clarity's sake, many people have already traveled for the Thanksgiving holiday before Zone 1 and 5 return to orange. Are you advising people from Zone 1 and 5 to return home at this time if they've already traveled outside their zone?
No, we're not telling them to go home immediately. They're already where they are. But certainly, while they're outside of the zone, they should be extremely vigilant about staying 6 feet away from everyone that they are with, wearing a mask at all times, washing their hands, and if they are visiting vulnerable people, to be extra careful. And if anybody from those zones has symptoms, they need to get tested immediately by using the online referral form, or they can call 811, but the referral form has been working very, very well. So have a very low threshold for getting tested and have a high level of vigilance in terms of protecting your loved ones this weekend.
Thank you, Dr. Ms. Hogarth. Do you have a follow-up?
It's just a quick follow-up. I'm wondering, as far as schools go, is there any weekly surveillance testing for staff? Is that something you'd consider implementing if not?
Well, at the beginning of the school year, again, we knew that there would be a heightened level of anxiety until things became a bit more routine. So we did offer asymptomatic testing to teachers in the first couple of weeks of school, and then that has changed. But certainly, if people are anxious, certainly in Zone 5 at the moment, the best approach at this point in time is really to listen to public health advice. If public health contacts you directly, that means you either are a close contact, or if you've had a test and they're contacting you because you're positive, then that's information that you personally can operationalize, act upon in terms of self-isolation and really being helpful with contact tracing. So, and what we're saying right now is if you have symptoms and you're concerned, you can get tested through the online referral form or from 811.
Thank you. Thank you both. Andrew Watt, Telegraph Journal.
Yeah, I'd like to, it doesn't matter to me who answers this question, but I'd like to understand how the Atlantic bubble works. And, like if the other 3 provinces decide to say, yeah, okay, this is too bad, you guys have got to get out. Like, how does that work? Does New Brunswick have any say in that? Or can the other 3 provinces just kind of shut us out of the bubble?
My understanding, Andrew, when the Atlantic bubble was established, it was done at the same time and very cooperatively, with the understanding that if one of the provinces out of the 4 started to experience a high number of cases and it looked like the other provinces needed to tighten up their borders as a protective measure, that would happen. So I have been in constant discussion with the Chief Medical Officers of Health from Newfoundland, PEI, and Nova Scotia to keep them informed of things as they as they evolve. So they're very, very aware of the situation and will continue to make their decisions around the risk at this time and moving forward. And as things change, they'll have more conversations with their premiers.
What is the tone of those discussions? Because I know Dr. Heather Morrison in PEI has already publicly expressed skepticism about New Brunswick's continued position in the bubble.
Well, all the chief medical officers of health, again, because I'm in ongoing conversations with them on a regular basis and through text and email and also phone calls. We were on the phone earlier today, and I spoke to Dr. Strang yesterday, that, again, they will continue to collectively evaluate their comfort level with respect to the risk as it evolves here in New Brunswick. And, the status quo is in place for the moment, but again, if they deem the risk to be too high for their provinces to want to continue to be in the bubble, then that's within their prerogative and completely expected with respect to how the bubble was set up in the first place.
Thank you. Did you get a follow-up? Yes. Ruben Paul, Radio-Canada.
Radio-Canada. My question is for Dominic Cardy. I would like to know, given the closing of a Sugarloaf school, what will be the situation? Will the school stay opened or closed? And what? Inaudible. Thank you for the question. Sugarloaf is closed for 2 days so far, Tuesday and Wednesday, and this had already been planned last week, given the change of policies in Quebec, because we weren't getting the cooperation we needed to assure the safety of the Listagouche community and others on the other side of the frontier. So we will be going to remote learning for those who live in Listagouche, but for the other schools, they stay open with increased measures, those that we mentioned a while ago. The only reason why we spent 6 months to make sure we had a safe return to school plan was to make sure we could make sure that the schools stayed open as much as possible. Yes, the academy as well. So we will always follow public health advice that if a school is needed, then certainly we will follow that advice. But at this point, and in collaboration with public health, we put together a plan to make sure that in many cases the schools can stay open. This is important for the students and their mental health. And for safety and public health is important, but we also have to balance the needs of students in all circumstances of their lives. So we'll continue that.
Because of the pre-existing situation with Quebec, where the government of Quebec was unable to offer sufficient security COVID protection controls to the government of New Brunswick, which meant that a small number of students who study in New Brunswick but who live in Listagouche, they had been attending school without issue. Now we're having to move them to online learning at the high school level starting next week. And so we're taking those 2 days with that school being closed, and it's coincident that there happens to be a case. Now we're acting on that as well. With the other school and with any other schools in the orange zone, the goal is to keep schools open for all the reasons that schools need to be open, for the mental health of the students, for making sure that their education continues, because this pandemic has been going on for the better part of a year and it's going to continue for some time. And the best way to get rid of it as quickly as possible is to have the best, most proactive measures in place. And so our effort is always to balance the education needs of each student with the safety of the staff and of the students. And so we're doing that. We've worked consistently with public safety to make sure our back-to-school plan meets public safety guidelines, and I'm hopeful that we'll be able to put an end to these 2 outbreaks and get back to the yellow phase, hopefully then the green, and in a few short months put this pandemic behind us. Merci.
Oui, s'il vous plaît.
Follow-up.
De coordonner dans les 2 régions où on est en phase
I would like to know if we're in the orange phase, would parents be able to keep their schools at home, and what other measures should they take? When the schools are open, the schools are open, and we will decide to close for 1 day or 1 week or for any time, but this will be based on public health advice. Right now, we don't have any reason to do that.
And we expect students to attend school when schools are open. And we'll work consistently with public health to make sure that we have the most up-to-date guidelines to protect the students and staff and the rest of the personnel at school. But as long as schools are open, and we expect students to attend.
Merci, Monsieur le Ministre. Merci. Margot Casteller, Radio-Canada.
Margot Casteller, Radio-Canada. Yes, my question is for Dr. Russell. Okay, you were saying that masks... Inaudible. Yes, it's true that in the two zones, the orange zones 1 and 5, masks are compulsory during orange zones, both inside and outside. Follow-up question, Margot? So that means, even outside, even during recess, we'll have to follow masks. Yes, that's correct.
Hey, Sackville.
Hi, I guess I'm wondering how many cases of the total recent cases in Zone 1 have now been identified as travel-related, how many related to the manoir, and how many are still under investigation?
So right now there are 3 currently under investigation, and the rest can all be traced back to the manoir.
No, we don't have any travel-related cases out of Zone 1?
There are travel-related cases right now in Zone 3, but that's a separate issue in terms of where they travel to and from, and they are self-isolating and have been self-isolating since their diagnosis. And in Zone 5, I know we have at least 1 travel-related case, but the contact tracing is very extensive right now, as there are many overlaps in terms of close contacts, so we're still analyzing all that information. It'll be a while before we can piece it all together. No, we have traced what we think might be an index case to that outbreak, but again, we still have 3 cases under investigation, and we have to put all this information together, so we're still working on that.
Ms. Butler, do you have a follow-up?
No, that's everything, thanks.
Voilà la fin de notre mise à jour pour ce samedi. Merci beaucoup. That concludes today's update for Saturday. Thank you very much.